My name is Amanda Owens, and I have the hyperbaric oxygen therapy chamber. The hyperbaric oxygen therapy chamber is a medical treatment that enhances the body's natural healing process by inhaling 100% of oxygen in a pressurized chamber that holds the patient. While in a hyperbaric chamber, the air pressure is increased to 3 times higher than normal air pressure. Under these conditions, the patient's lungs can gather more oxygen than would be possible breathing pure oxygen at normal air pressure. The patient's blood then carries the oxygen throughout the body. This process helps fight bacteria and releases substances called growth factors and stem cells, and these substances promote healing. There are 2 types of hyperbaric chambers. There's a monoplace and a multiplace. Monoplace accommodates 1 patient, and the patient enters and the chamber is then closed and pressure increased. The patient does not have to wear a mask or hood to receive oxygen. And each treatment is designed specifically for each patient. However, the patient is inaccessible to staff during treatment if any emergency arises. The multi-place accommodates several patients at the same time. These patients receive oxygen through a face mask or hood while in a pressurized room. Unlike the monoplace chamber, the multi-place chamber holds 1 staff member inside the chamber, and the patients receive the same treatment. There are only select few treatments that you treat with the hyperbaric chamber. These include air gas embolism, carbon monoxide poisoning, smoke inhalation, decompression sickness from scuba diving, radiation tissue damage, thermal burns, non-healing skin grafts, crush injuries, wounds that fail to heal, serious blood loss, and intracranial abscess. Risks of hyperbaric oxygen therapy are very few, but they may happen. These include temporary nearsightedness or myopia, middle ear injuries including leaking fluid and eardrum rupture due to increased air pressure, lung collapse due to pressure or barotrauma, seizures as a result of too much oxygen toxicity, and rare cases fire due to an oxygen-rich environment. The number of sessions for treatment depends on each patient's medical condition. Some conditions such as carbon monoxide poisoning may require 3 separate treatments, and non-healing wounds may require 20 to 40 treatments. These treatments in total last an hour and a half to 2 hours. Actual treatment time of 100% oxygen administration is 60 to 90 minutes. Pressurized and depressurized time period is 10 to 15 minutes each. For approved conditions, as stated before, Medicare reimbursement is available. For a 1-hour treatment, prices vary from $108 to $250 at private clinics. For a 1-hour treatment, prices may run over $1,000 at hospitals. Although we do not have a hyperbaric chamber, I have set up an example of how a patient would present and the process you would go through. This one patient would be receiving monoplace chamber. So he would be lying in the chamber, and we would close the hood, and the only way I would be able to access him is through a telephone. The vital signs, as you can see, is he would be tachycardic, tachypneic, hypertensive, and he would also present with fever. Some of the symptoms the patient would have when he would come in would be confusion, chest pain, dyspnea, weakness, vomiting or nausea, headache, dizziness, convulsions, shock, or unconsciousness. Now, since he would be in a monoplace chamber, he would not have a mask on his face, and he would be enclosed in one area. This is my project on the hyperbaric oxygen therapy chamber.